Good afternoon, and thank you for the kind introduction. I'm sorry we can't all be together sharing lunch in a view at Wentworth by the Sea, um, but really want to start by thanking you for your attendance today virtually in the ongoing support of the New Hampshire Medical Society Annual Conference. As a small consolation, I've tried to find a virtual location myself that has a view of the Piscataqua River. You can see behind me, slightly upriver from the Wentworth by the Sea, but a partial view nonetheless. Um, I'm truly humbled by the opportunity to serve as the 189th president of the New Hampshire Medical Society, and certainly feel the gravity of living up to the standard and expectation that's been set by New Hampshire Medical Society presidents in the past. I myself began my association with the Medical Society as a medical student representative in 2009. I left New Hampshire for my residency training and then returned afterwards and have since served as a young physician representative, the vice president, and then most recently as the president-elect. And through these years as of being part with the Medical Society Council, I've had the opportunity and the blessing to see firsthand of what it's meant to be effective as a president and a leader of the medical society. And those common themes of success, the most prominent themes, I distill down in to dedication, the ability to address current events, and having relevant passions that fit into the mission of the New Hampshire Medical Society, and that mission being to bring together physicians across specialties to advocate for the well-being of our patients, our profession, and the overall betterment of public health. Um, Now it's this last point, the individual relevant passions that past presidents have brought, that's been the most impressive to me. And it's been most impressive because although those passions have differed, they've all been successful in being able to achieve something significant around them. Most recently, with Dr. Klunk in his efforts around the social determinants of health and the formation of the Health Equity Advisory Council. Prior to that was Dr. Leffertune Greenberg and her efforts promoting vaccination programs across the state. And before that, Dr. Harrigan and her passion around physician leadership, which resulted in the formation of the Physician Leadership Development Program in conjunction with UNH. And it's these three themes that I aim to bring to my own presidency in the coming year. Now, first, with regards to dedication, that starts with my family, and it's through the support of my wife Rachel that I'm able to dedicate myself to the medical society and help promote this mission in the year to come. Rachel has been my partner and confidant in every important endeavor I've embarked upon in my adult life, and it's her support and input that's allowed for some of those to result in success. Rachel herself is a nurse. Her first job out of nursing school was to work in the refugee camps in the conflict in northern Uganda and Sudan. After she met me, she followed me to Boston while I was in training. She worked for Boston Healthcare for the Homeless for 4 years, and while doing so, earned her public health degree in disaster management, in addition to carrying our second child. During those same years, we together founded a healthcare consultancy that brought our entire family to the Middle East to help prepare Cleveland Clinic Abu Dhabi for their opening to clinical operations. And most recently, Rachel supported me in founding Doc to Doc Lending, and currently serves as our director of operations, where she's overseen our growth currently to $2.5 million in our portfolio, and having reached doctors across 22 states, 26 specialties, and representing over 50 academic institutions. And, I really emphasize Rachel's accomplishments, because not only is it her support of our family that allows me to dedicate myself this year, but Rachel is really the first line of defense for some of the ideas that you'll hear tonight, and I'm sure the council will hear throughout the year. We vet these over the dinner table, and it's through Rachel's thoughtfulness, experience, and intellect that those ideas are shaped into the final products. And so thank you, Rachel, for what you do for our family and for me, and for allowing me to embark on this adventure over the coming year. Now, the second point, preparing for current events and being able to effectively address current events. There really couldn't have been a better case study written for this than was the early part of 2020. And through the leadership of Dr. Klunk, Jim Potter, Mike Padmore, the entire council and staff here at the Medical Society, this medical society was able to ensure that the voices of physicians in the state were heard as policies were being developed and evolving rapidly. Although this year should not be quite as unexpected, certainly the ongoing efforts around the COVID response will continue to evolve. Even over the next couple of months, we will see the rollout of a massive vaccine initiative. And as that is being rolled out, the Medical Society has already become involved in helping to ensure that success. As the prevalence in our communities continue to trend and shift, the Medical Society is going to act to continue to make sure that the voice of physicians are heard, both as representative of our profession and our patients. And we'll continue to look for you, the community of physicians and the Medical Society membership, to share your experiences, your challenges, so that we can advocate in a way that's most effective. So please reach out to us, continue to let us know what you're seeing and where the pain points are, and we will continue to make your voices heard as we address what will be one of the greatest public health challenges of our generation. Now, the last point, the relevant passions. I mentioned the relevant passions and the successes around those passions that have been able to be achieved by past presidents. And what I am passionate about and hope to bring to the Medical Society is the engagement of young physicians, and how to do that in a way that is meaningful and effective. Now, I'm going to temporarily here share a slide just to demonstrate that this is something that I believe the Medical Society can and should do. What we see here is a graph where on the x-axis is age, and on the y-axis is percent of membership or percent of the community. And we're going to start with this yellow or orange line, and this represents the licensed physicians in New Hampshire. And these are categorized into 5-year age aliquots. So, for example, this is the 25 to 30 year aliquot. You can see just about 1% of licensed physicians in New Hampshire represent the ages of 25 to 30. And you can see that expectedly, between the ages of 35 and 60, that's where there are the highest proportions of licensed physicians in the state. Now, when we compare that to the membership of the New Hampshire Medical Society, that's represented here by this blue line, can see that there's this early spike, and we expect that this high prevalence in the early years are because we offer free memberships to our resident physicians and medical school students. But soon after that, the relative proportion of members in these early ages drops as compared to the proportion of the licensed physician. And so what we'd like to do is improve the engagement of these early career physicians and address this gap here. Now, there are three specific ways in which that can be attained in the coming year. The first is by helping to break down some of the barriers of accessing job opportunities for those young physicians who want to practice in the state of New Hampshire, both who are already here and who are coming from outside of the state. Number two is by facilitating opportunities for career advancement of young physicians and using the New Hampshire Medical Society platform to help address that. And then lastly is by offering resources to improve personal and professional financial literacy, particularly for young physicians, which we know is something that is in high demand for those years and is a gap in our medical education training. Speaking to each of these three means of engagement of young physicians individually, the first is the breaking down barriers to job opportunities, and really for young doctors who want to practice in New Hampshire. And having lived through this myself, one of the main challenges is knowing where those practices are for a given specialty and identifying where the opportunities may lie. The medical society has an opportunity to soften some of these hurdles, to help those connections be more readily made, and to help young doctors practice in New Hampshire. And it's an issue that we know is front of mind, particularly for people in the early stages in their career. The second mode of engagement is through career development, and many of us know career advancement in medicine is often facilitated through clinical excellence, leadership experience, and research publications or presentations. And these depend on what type of practice you practice in. For young physicians, really one of the hardest parts of all this is getting the first opportunity at a leadership role, or that first opportunity for presentation to be made or research to be published. And over the coming year, Medical Society is going to help facilitate those opportunities for young physician members, to help get that first rung on the ladder, so to speak. And we'll do this by continuing the work by Deb Harrigan that I referenced earlier, with the New Hampshire Physician Leadership Development Program, and continuing to include young physicians in the matriculation to that program. We're in our Medical Society publications, we're going to include a young physician focus to help recognize the impact that young physicians are having in our state, and certainly would welcome your experiences in those rising stars, those young physicians in your own institutions who are making an impact on the state level, so that we can help promote those accomplishments. Next year at this conference next year at Mount Washington, we will be including a significant number of young physician presenters as part of the agenda. There's some really exciting research and work being done by these young physicians, and next year we're hoping to highlight the achievement that they're having at the annual conference. And then lastly, we'll continue to identify at the state level committees and opportunities for leadership for those young physicians who want to become more engaged and get additional leadership opportunities. And as I mentioned earlier, we'll certainly look to you to help us identify these physicians. Please be in touch with myself or Jim Potter, and would be really excited to connect with them ourselves. Now, the last part was around financial literacy, and I mentioned this as a passion of mine, and I'll give a little bit of a background as to exactly how this became a niche that I fell into myself. And I'll start by sharing my own experience financially as a young physician. It's something that we don't talk a lot about, but as I mentioned, is really front of mind, particularly for young physicians. When I graduated medical school, I graduated with $225,000 in student loan debt. Rachel and I, we had 2 daughters. As I mentioned, we were living in Boston and really a not great part of Jamaica Plain. Our rent was $2,000 a month. My salary was $54,000 a year. This isn't dissimilar from what we know as the current position of medical student who graduates an average of just over $200,000 in debt. The average resident salary currently is just about $60,000 a year. And for Rachel and I, when we did the math of what it would take financially to keep us, our personal and professional lives moving forward, growing a family, continue our advancement of our careers, we had to supplement my salary. When we went to banks, we were viewed as high risk because of the amount of debt I carried relative to my income, and at the time had a relatively immature credit score. And this was in light of this, why Doc-to-Doc Lending was founded, to offer capital to doctors, particularly early on in their career, by looking beyond these traditional metrics and offering more favorable rates. As we opened Doc-to-Doc, we found that this experience is shared by more young physicians than you would expect. As I alluded to earlier, in just over 18 months, we've lent $2.5 million across the entire country, and a lot of these stories are of these borrowers are really moving and similar to my own. Now, as part of that process, we speak to each individual applicant in our platform, and so this has been hundreds of conversations between physician members and physician borrowers. And through those conversations, there have been common themes that have come up across specialties, across geographies, but specific to the experience of being a young physician and the financial challenges in the education and knowledge gap related to personal and professional finance. And so it has become a niche passion of my own. We know that the demand for this type of education is on the rise. There are physician communities now that are centered around financial literacy, where some of these have 1 in every 5 physicians in the country as members. The opportunities and requests for speaking engagements for young physicians, residents, medical students around this has been exponentially increasing, including through my own role. And so, in the coming year, what I will hope to do is to address some of these common themes and address these in ways that are meaningful and engaging to the young physicians in our state, and to help make what we do through the medical society even more relevant to those folks early on in their career. Now, in closing, I want to again thank you all for this opportunity to serve as president of the Medical Society. I look forward to this conference being the first of many opportunities to engage one another throughout the coming year. Please reach out to me personally, to the Medical Society staff, with your thoughts, experiences, as we continue to advocate on your behalf around issues that are relevant in the coming year. Please enjoy the rest of the conference, and we look forward to hopefully seeing you all again in person next year. I know I would look forward to that opportunity, and it's planned for the Mount Washington Hotel, which again is another beautiful venue, and hopefully we won't have to revert to background pictures on the wall. So thank you very much. Enjoy the conference, and I'll look forward to being in touch in the coming year.